Good afternoon, everyone. My name is Elena Belousova. I'm a ophthalmologist and I have a PhD degree of medical science. I'm senior research officer of National Myopia Institute in Moscow and chief medical officer of Krugozurai Clinic Tula. And first of all, I'm very happy to be part of such big international conference, and I'd like to thank the organizer, the content company, who made this performance possible today. The topic of my presentation is SMARTFIT new customizable Scleral lens design. And I want to start with my disclosed. I am senior lecturer of Academy of Medical Optics and Optometry. I'm vice president of Euro Australian Asian Scleral Lens Academy and chief medical officer of Krugozurai Clinic in Tula and professional consultant of OKVision laboratory. And now let's go to start. And first of all, I want to talk about the Scleral lens definition. What is it, Scleral lenses? A Scleral lens is a cast, permeable, self-supporting contact lens that, like a dome, overlaps the cornea and limb and rests on a scleral covered with conjunctiva. And as you know, the most popular patient whom feed their Scleral lenses is the patient with primary corneal ectasia, such as keratoconus, keratoglobus, polysomarginal degeneration. But at last time, very often, there is a big group of patients with secondary corneal ectasia with condition after different kinds of refractive surgery, with patient with graft after keratoplasty, with scars after injuries, condition after implantation of corneal segments, and others. But the last time, more and more practitioners like to feed Scleral lenses to the patient with regular corneas with high myopia, with astigmatism and presbyopia. And I know that you can know about therapeutic use of the lenses in various eye conditions, with condition after erosion of the cornea and various etiologies, with dry eye syndrome and with different kinds of dystrophies. And in some cases, the problems with other types of lenses can lead to fitting scleral contact lenses in case when RP or corneal lenses do not fit well enough, and in cases when the patient have intolerance to RGP or soft contact lenses, and if you have poor vision in soft contact lenses, or for example, you need to use the conflict designed toric, multifocal, bifocal, and some others. And there are some very rare indications. For example, episodic use of contact lenses, and it can be easy with Scleral contact lens that with RGP or soft contact lenses, for example, when patient combat sports, and in some cases for professional reasons, when the patient works in dusty environment, use of protective equipment and some others, and in cases for water and active sports, and climate conditions, and in some cases we need to use the tinted Scleral contact lenses for cosmetic purpose. And I'm highly recommended you to read this article, and you may know about more and more about indications And let's start to talk about new contact lens in Russia. The OKVision SMARTFIT Scleral lenses. In 2020, head of OKVision company, Dr. Alexander Merkov, professor, doctor of medical science and ophthalmologist, together with the leading specialist of National Myopia Institute and the OKVision laboratory, developed and launched new OKVision SMARTFIT Scleral gas permeable lenses, the first Scleral lens design developed in Russia. And you can ask why OKVision SMARTFIT are customizable. OKVision SMARTFIT design provides better centration of the lenses regardless of the toricity of the sclera and high visual acuity. And parameters of the Scleral lenses ordered during 4 years were analyzed, and the analysis of question and request of practitioners was carried out. And with all of this information we use in producing new contact lenses. A design was developed with maximum details, 2 parameters in the most demanded range. You can choose the diameter from 14.2 to 16 millimeters with step for 0.2 millimeters, base curve from 6.4 to 9 millimeters, by step 0.05, and optical power from -20 to +20, and with step 0.25 diopters. Our unique design is their ability to quickly make any changes at one moment, ability to go beyond the standard parameters within OKVision SMARTFIT design. And now I want to talk about the advantages of OKVision SMARTFIT. First of all, their design flexibility, individual approach according to your request, directly communication with laboratory and professional specialists. Improved lens centration due to the optic zone. It's the main problem in some cases when we need to fit, when you need to have good fitting, and this good fitting lead to the high visual acuity. And dynamic design for full customization of the landing zone, ability to modify the haptic in 4 quadrants, and your stabilization method for symmetrical sclera D4D, and high limbal zone compared with other designs of mini-scleral lenses. It's very important, as we know, the good clearance parameter in the limbal zone. And additional design for myopia control and wide variety of diameters, up to 10 options. And what about the lens materials which we use for producing these Scleral lenses? We use modern lens materials supplied by Counterpart Company, and we use 3 types of materials: Optimum Extra, Optimum Extreme, and Optimum Infinite. As you know, the difference between these 3 types of materials is oxygen permeability. For Optimum Extra, decay is 100. For Optimum Extreme, the decay is 125, and for Infinite material, the decay is 180. And you can choose for your patient the higher oxygen permeability in very difficult situation when you work with a patient with very in some cases with corneal didiotis. Now let's talk about parameters of these OKVision SMARTFIT lenses. And first of all, I want to talk about central zone. The central zone consists of base curve and optic zone. The base curve determines the overall curvature of the lens and the area of the cornea that it covers. Base curve range from 6.4 to 9 millimeters, and for convenience of fitting, we mark between millimeters. The optic zone, including the back and front optical zone, has diameter of 9 millimeters and determines the optical power of the lens in diopters. And now about limbal zone. This traditional zone and the curvature of the limbal zone of the lens provides the necessary limbal clearance and has direct connection with the base curve of the lenses. And unique design of OKVision SMARTFIT allows you to optimize and expand the limbal clearance for each lens to compare to other design. In some cases, you can make higher or lower this limbal zone if you need to have higher or lower limbal clearance. And now about very important zone of Scleral lenses, the haptic or landing zone. The haptic zone of this multi-radius, and each radius following from the center becomes flatter, which ensures a smoother transition of optimal landing in the conjunctiva, and an increase in the width of each radius of the Scleral zone forms an overall diameter and a more stable lens fit. And what we need to know about fitting process, the design of OKVision SMARTFIT. Very important, what you need to remember that as you know, you need to use the diagnostic kit. It makes your fitting easier, and when you start to work with fitting diagnostic kit, you need to select the diameter of the lens and base curve, and when you fit your lenses on the eye, you need assess the apical clearance, the limbal clearance, and lens age and lens mobility. And after that, you need to check the order of refraction and then calculate and place in an order. When you have the final lens, you fit your final lens on your patient and check and repeat the assessment of the apical clearance, limbal clearance, lens age, fit, and of course lens mobility. And after that, you educate your patient about fitting, about rules of use and care with further observation. It's very important to do for better using the Scleral lenses. And how to select the diameter and base curve. The diameter of the diagnostic lens is calculated based on HPAD parameter. The edge of the lens with proper fit should extend beyond the limbus in each meridian by at least 1.25 millimeters, ideally by 1.5 or 2 millimeters. If you want to calculate the minimum diameter, you you add to your diameter of the patient 3 millimeters. And finally, you have the diameter of your diagnostic lens. The limbal clearance, what is it important? Why is it important? As you know, there are stem cells located in this area, and every time we need to check the limbal clearance, and you can do this with biomicroscopy on OCT, can help us in case of insufficient limbal clearance. The most effective option is to change the parameter of the limbal zone by increasing the diameter of the lens. And if you choose increasing the diameter of the lens by 0.2 millimeter, lead to an increase in limbal clearance by 50 microns. Or you can locally clearance rise, and for example, for plus 50 microns. And of course, so now we need to talk about assessment of haptic zone. The haptic zone should be evenly supported on the sclera without compression and its traumatization. Avoid conjunctival blanching. The local areas of the conjunctiva surrounding the limb may turn white, pale due to restriction of conjunctival blood flow due to compression of its lens edge. A well-fitting lens should be semi-sealed to the eye with minimum or no mobility. And if the edge of the lens is too steep, it can clamp the conjunctival tissue. And on the picture on the slide, you can see the optimal connection, the edge of the lens with scleral and conjunctiva. And when we have any problems, as you know, not all the patients have symmetric parameters of sclera, and very often we work with a patient who has a very toric or asymmetric parameters of sclera, and this is avoid a lot of problems when we try to fill the landing zone of scleral lenses. And on the first picture, you can see the lens decentration. On the second, you can see conjunctival prolapse, which most often occurs in the lower quadrant of the lens and is asymptomatic. And on the third picture, we can see excessive edge lift, which we can see using the fluorescein or lissamine green. And now what we can do, for better line of the edge in OKVision SMARTFIT design. For better stabilization, OKVision SMARTFIT design lenses on the patient eye, you can choose one of the 4 different haptic zone design which are available now. First, design spherical haptic zone, the second toric peripheral curve, and the third independent for quadrant design, and the last one dynamic for design. And if you have a patient with spherical sclera in 6% or with if we work with patients with toric sclera in 30%, and you can choose the dynamic for design. It's a new peripheral design, our most advanced haptic zone design options. With an asymmetric elevation of the edge is one of the quadrant. D4D design is used, which spread the edge of the lens in this quadrant at 75 microns. And this can lead for better centration and stabilization, and finally to help us to have high visual acuity. And if we work with patients with toric sclera, very often we choose the toric peripheral curves option for better alignment of the lens edge relative to the patient's sclera in 2 meridians. Our experience has shown that when we fit midi-scleral lenses in the region of the edge of the lens, the toricity of the sclera is an average 100 microns. And we can choose, for example, one of the options of TPC design standard and in 1 meridian, and step 1 in another meridian, or flat 1 in 1 meridian and step 1 in another meridian. And it leads finally to better centration of the haptic zone. And finally, when we have asymmetric sclera, we can choose independent for quadrant design. This design with toric peripheral curve for better alignment of lens edge in each quadrant relative to sclera. The flexibility of the OKVision SMARTFIT design helps make change in edge lift not only in 19 degrees increments, but also in any others. For example, 45 degrees or 60 degrees, so-called multimeridian design you can choose in these cases. And finally, to summarize, we have 4 haptic zone design, and we can choose one of them for better line of the haptic zone in when we work with OKVision SMARTFIT lenses. Now I want to talk about the new design OKVision SMARTFIT for myopia control. For the first time in the world practice, we use OKVision, the focus control technology, in production of induced Scleral lens. This interior surface design simultaneously forms a central focus in the macular region and induced peripheral myopic focus. Unlike orthokeratology lenses, OKVision SMARTFIT, the focus control lens technology, Scleral lenses do not have a modifying effect on the cornea epithelium. And OKVision, the focus control lens technology, currently produce lens with controlled peripheral myopic defocus with an addition value from 2 to 7 diopters. Step 025. And now I would like to talk with you about their Scleral lenses OKVision SMARTFIT for myopia control. For the first time in the world practice, OKVision SMARTFIT Scleral lenses use OKVision, the focus control technology. This the anterior surface design simultaneously forms a central focus in the macular region and an induced peripheral myopic focus. Unlike orthokeratology lenses, OKVision SMARTFIT, the focus control lens, do not have a modifying effect on the cornea epithelium. OKVision technology, the focus control technology, currently produce lenses with controlled peripheral myopic defocus with an addition value from 2 to 7 diopters, step by 25, and finally we use 4 diopters. Another special design of OKVision SMARTFIT, multifocal design. These lenses were designed for moderate and active patients with presbyopia. Multifocal design of OKVision SMARTFIT employs a simultaneous lens design, and the optic zone of the mirror is wider, and in binocular vision condition, high visual acuity is provided for medium and short distance. And the third special design of OKVision SMARTFIT, the tinted cosmetic contact lenses. And as we can show on these pictures of our patients, which now wear their tinted contact lenses, we have the excellent cosmetic effect, and we have 100 repeatability of the iris pattern, because for producing in producing of Scleral contact lenses, we use their photo of natural iris of our patient. The stable position of the lens on the eye help us to have the perfect comfort, and we can any shape and profile of the surface we can with the Scleral lenses. And to summarize my presentation, I would like to show you my clinical case. The patient P-White Woman, 38, she came to the clinic and she complained about Scleral lens fogging and pathological mobility after 1 hour and a half in contact lenses. She has keratoconus stage 3, 4, 5 years, and the first Scleral lenses were fitting in at the clinic and weren't during 1 year. During the eye examination, we saw lens disintegration, excessive lift of the lens edge, lens fogging after 1 hour and a half, and she was recommended the refitting new lenses of OKVision SMARTFIT design. For trial lens, we use the parameters of the cornea of the patient, and their initial data were the right eyes diameter of the cornea 20.47 millimeters, and the flat radius of the cornea about 10 millimeters. On the left side, the diameter of the cornea was the same, about 20.34 millimeters, and the flattest radius of the cornea 7.13 millimeters. And we chose the trial lenses with diameter 15.2, BC 7.8 for the right eye, and BC 8 millimeters for the left eye, and TPC design of the edge, step 2, step 3 for the right eye, and step 2, step 4 for the left eye. And during the examination, we saw on the right eye lens centration and H line, but on the left eye we still have decentration and pattern of lissamine green of the lower segment of the lenses. Final lenses we have for SMARTFIT design contact lenses with diameter 15.2 and with base curve 7.8 for the right eye and optic tone minus 0.5 and the H with TPC design step 2, step 3. For the left eye, the same diameter and the C8 millimeters and the optic plus 0.25 diopters and their H TPC design with step 3, step 5. Both lenses with TPC H design shown us their very good concentration and very good weakening of the H, and after 1 month of wearing, the patient noted high visual acuity and long-lasting comfort and lenses for 14-15 hours. Even when she working at the computer. And to summarize my presentation, I want to repeat the advantages of OKVision SMARTFIT design Scleral contact lenses. First of all, design flexibility. This is individual approach according to your request, and you can directly communicate with laboratory and professional specialists, and improve lens integration due to the optic zone, and dynamic design for full customization of the landing zone, ability to modify the haptic in 4 quadrants, and your stabilization method for symmetrical Scleral D4D, high limbal zone compared with other designs, additional design for myopia control, and to traditional special design multifocal and cosmetic contact lenses, and wide variety of diameters up to 10 options. Thank you for your attention, and if you have any question, you can write me on my mail, and goodbye.